Coalition Recovery is a substance abuse treatment center in Tampa with many treatments to give individuals the best chance for long-term success. Four-time board-certified psychiatrist Dr. Deborah Barnett joins us to discuss their latest advancements in addiction medicine. And I'm already going to tell you, I have enjoyed talking with you even getting started here. So glad you're here today.
Well, thank you so much, Natalie, for having me on your show.
So as you and I were talking, I'm so impressed by the accolades that you have. And I know she's not going to want to brag on herself, but of course, that's where we come in. You've been passionate about this, have the degrees to back up your work in addiction, and now being able to create a recovery program. Talk a little bit about your background before we dive into what you're doing.
Sure, thank you. So I'm a physician. I trained in medical school like any other medical specialist, then did training in psychiatry, and then I've gotten board certifications within psychiatry and subspecialties of psychiatry.
And in psychiatry, which I've learned, sometimes you don't have a psychiatrist over recovery programs. And that seems like it's kind of the old school mentality because the treatment of addiction has definitely evolved over the years. And so taking that schooling does help Coalition Recovery stand out above the rest.
Definitely.
With that background, though, let's talk treatments. How are you able to stand out? How have you put your education experience into this new recovery center?
Yes, great question. Thank you. My desire for many years has been to partner with a treatment program that would incorporate and embrace evidence-based practices in 21st century medicine in its approach to the treatment of substance use disorders. Now, when I say 21st century treatment, I'm talking about treatments that have been available for perhaps 15 years, some of them a little bit longer. And despite those treatments being available, and these are medications that I'm talking about, in addition to specialized therapies, despite the availability, there is still a lot of patients, families, and even treatment centers that don't embrace those practices.
And of course, maybe someone you know or someone you love has faced addiction before, or maybe they haven't. Maybe you don't realize how this really is an epidemic. And of course, we throw that out there. We were discussing the opioids. That's, of course, in the headlines all the time. Talk about how much this is a society problem. It's not just an individual situation.
Correct. It hits on many levels. It's certainly a medical problem. It's a disorder. It's a brain disease. It also affects the person in their immediate sphere. We call it a psychosocial problem, and it's a public health problem. It takes all of these approaches, and will take all of these approaches to conquer this opioid epidemic and the number of deaths that we see yearly from the epidemic.
And we also have some graphs, too, that we're going to show you to talk about some of the changes that we've seen from the way addiction used to be treated to what you're able to do, and the outcomes, which is key. And of course, we're going to take a look right now at alcoholism and how that's being treated, right?
Yes, we are. So first of all, there are several medications that we can use to treat alcohol use disorder or alcoholism. What I have brought with me today is a slide having to do with one of those treatments, and it's called Vivitrol. It's a once-a-month injection. That's, again, it's been around for 15 or 20 years. The kinds of things that we look at in the studies for treatments for alcohol look at things like time to relapse, the number of drinking days per month compared to placebo group versus medication. And if a person does relapse or slip and drink again, they tend to drink less. So in that particular slide, what we see is the number of drinking days, that at baseline, and then with the medication compared to placebo, there's a 97% difference between those two treatment groups.
Well, in closing here, we've got about 30 seconds. I want to go ahead and make sure we have the opioid graphic too, because of course that's another addiction that you treat at the Recovery Center.
Yes, very much so. Again, there are several medications, and in this particular slide, we're looking at buprenorphine. Treatment retention is what's reflected in this slide. And what you can see is that on medication, people tend to stay in treatment about 75% over the course of many, many months, almost a year. And yet, within the first 30 days, a lot of the people not on the medication fall out of treatment. This is a direct correlation with overdose deaths.
Again, I think that's a poignant moment to hear you say, will you please come back and let's talk about this more, because we want to dive in more about how you're able to help and of course how people can seek help. But we do want to share your information as well. Of course, Coalition Recovery, there's the address, website, phone number. And again, Dr. Barnett, please come back so we can talk about this further, okay?
I would love to, Natalie.